A guide for documentation of the initial evaluation for physical and occupational therapist in Kinzer. This simple training will guide you on how to fill out Kinzer evaluations for occupational and physical therapy. Green highlighted areas are auto-populated information, so you do not have to input anything during your documentation. Yellow highlighted areas are the areas to be filled for both geriatric and pediatric patients. Blue highlighted areas are for the geriatric patient only. Check patient identity box. Time format must be in military format. The medical diagnosis found on the referral sheet or client intake sheet. In the diagnosis section, type in the diagnosis after thorough assessment was done, as well as the onset or exacerbation date. Type in child's relevant medical history. Priority level of function of the child prior to the medical condition. Type in the patient's goal for geriatric patients and/or the parent's goal for their child. Type in necessary precautions, especially if the child's balance is compromised. Homebound reasons to justify why the patient's therapy intervention should be done at home. Vital signs may be warranted for pediatric patients. Use your best judgment. Take note that the pain scale of 5 and above must be reported to Theramax patient intake specialist and to the HHA where the patient is affiliated with. For the PT evaluation form, you measure both the upper extremity and lower extremity ROM and strength. Describe your overall findings based on the assessment. Include your justification why the child should be needing physical therapy or occupational therapy intervention. If a standardized tool was performed, scores should be stated here as well as the age equivalence and the age of delay. For evaluation that is accompanied with measurement tools like P-body assessment tool, the easiest way to formulate your goals is to review your evaluation tool and find the functional mobility that the patient is delayed based on his chronological age. This abbreviation might help with goal setting. SMART, significant, measurable, achievable, relates to person, time-based. Sample treatment goals. The goals above are based on the result of the P-body assessment tool, PDMS, of 21-month-old boy on object manipulation and grasping testing criteria. For pediatric patients, please indicate for initial evaluation only. Guide in writing the evaluation frequency for pediatric patients. For initial evaluations and 30-day re-evaluations, you may place the date effective on the day of your initial evaluation and the initial evaluation frequency. Example 1. You completed your initial evaluation today, 01/13 of 2014, and your frequency is 2W26. 26 weeks is equal to 6 months. Your date and frequency will be 01/13/2014, 2W26. Example number 2. You completed your 30 days re-evaluation for the same patient on 02/11/2014. Now your date and frequency will be 01/13/2014, 2W26. You just copy the original initial eval frequency. Example number 3. You are now scheduled for 6-month re-evaluation for the next authorization within 30 days before the end of the 6-month present authorization. The present authorization is between 01/13 of 2014 to 07/12 of 2014. Date of re-evaluation visit 06/14/2014. Now your frequency and date will be 07/13/2014, 2W26. But for pediatric patients, you may add to the other section, to family care when maximum rehabilitation potential is achieved. Click the Save Answers as a template so you can pre-fill your next evaluation should you have the same diagnosis for any patient. Standardized Tools, P-body Development Motor Scale 2nd Edition. Please take note that when a child has a diagnosis of developmental delay, there is a need to perform standardized tests in order to medically justify the needs to receive PT and OT services along with the evaluation being performed. Now, these scores will then be carefully reviewed by the TMHP reviewer or HMO medical reviewer in order to approve the number of visits recommended for the child's therapy. This tutorial was created by Theramax Marketing and Quality Assurance Department. Visit us online at www.theramaxtherapyservices.com. Call 713-244-9505 for questions regarding your orientation or for more information about our staffing services.